Prynhawn Da, good afternoon and welcome to this Bevan evaluation of Cohort 6. My name is Professor Nick Rich and I've evaluated every of the Bevan Exemplar Cohort since their inception a few years ago. It has to be said right up front that this has been a very unusual year, a very unusual period in time. This particular cohort is a shorter cohort than the typical Bevan Exemplar group. And the typical Bevan Exemplar group would last a year. This has been conducted, and these projects have been conducted in half the time. So quite unusual circumstances, quite a new form of experiment for the Bevan Commission. Given the devastating impact of a pandemic, the thinking at the time was that, well, probably most of these projects would fail. This is a most imperfect storm in terms of not knowing what to do, how to react, and whether it's worth keeping improvement projects going. So the circumstances could not have been worse, really. But the projects were launched and they were rolled out. So the range of projects that were undertaken was incredibly wide and broad, involving a huge number of different patient journeys and pathways across Wales. So here's just a few of them on the following slides. You can get a greater sense of the projects that were involved by going to the website. Here we can see investments that have been made by the Anar and Bevan University Health Board in terms of vertigo and balance disorders and physiotherapy diaries to aid co-production and post-COVID outpatient service designs. In Betsy Cadwallader in the north, we can see Healthy Start vitamin programs, getting treated more easily for sexual health services, interventions in domestic abuse, improving the counselling and delivering of postnatal contraception, validating treatment options for lung cancer patients, interventions for chronic pain management, creating buddies for junior doctors, reducing blood sampling in ICU, bespoke one-stop hypertension clinics, and virtual pain management programs for osteoporosis patients that are in the process of heading towards surgery. At Cardiff and Vale, we see interventions in Get There Together, the resource to support people to access their communities. We've also seen applications of interventions into the Parkinson's pathway and the development of the Omnium Centre. From the Cwmtaf Morgannwg University Health Board, we have clinical specialist physiotherapists, the development of multidisciplinary clinical pathways and education packages to help the robust management of tissue viability in young children, particularly young children with complex needs, and the development of an immersive environment using virtual reality to manage chronic pain in a primary care setting. These are all quite phenomenal interventions of quite transformational nature. From Hawddar, we have a great and a wide portfolio of projects that have been sponsored, including increasing time spent at home for improving unscheduled care, a digital-first approach to patient correspondence, the Pembrokeshire Blue Team advice line, waiting list support initiatives, urgent general practitioner response unit for acute medical care in the community, secure services for referral and step-down pathways, Mind Over Food to give us a more healthy approach to eating and obesity, vascular catheter preservation initiatives, and transfer of care and liaison service prevention screening projects. Adding to that, though, are other projects which include the virtual COVID-19 ward and recovery through activity implementation and evaluation of online occupational therapy interventions across Wales. Within the Powys Health Board, we've seen the Green Bees environmental programme to help staff develop a more sustainable future and engage themselves with environmental issues that surround wards and care delivery processes. We also see digital education for non-clinical staff to promote the use of virtual consultations for people with persistent pain and fatigue in the rural areas of Powys. And finally, we see from Swansea Bay University Health Board a revised early years neurodevelopment assessment pathway and toolkit. So I think you'll all agree there's a very broad range of activities here that cover many of the most critical conditions and the most vulnerable patients. So a very good investment portfolio from the Welsh Government and the Bevan Commission. And just to put this into context, we are dealing with projects of an innovative nature. So this was found in our survey of the Bevan exemplars. that they thought their programs were more innovative. 79% of those involved with the program agreed that their program was highly innovative in the way it treats a condition or supports staff. So with innovation comes risk. And in the great pandemic, as well as all of the other things that are going on, these Bevan Exemplar project leaders are undertaking with their teams highly innovative and therefore highly risky programs. Not risky from a clinical sense or patient safety sense, but risky in terms of we don't necessarily know the outcome. So you can see here that virtually everybody involved with the program, all of the exemplars that were profiled, to somewhat or strongly agreed that their programs were innovative and would fundamentally step change the care that's delivered. Furthermore, do the projects actually represent prudent principles in action? Well, unsurprisingly, they all represent prudent principles in action, with again 79% stating that they strongly believe their projects were the physical embodiment and the implementation of prudent principles in action. So we have innovative projects that demonstrate and are seen to demonstrate the prudent principles. So yet again, we can assure ourselves that this is another test of the Bevan principles, as much as it is a test of the different pathways, patient journeys, and communities that are involved. Now, before I get to answer the acid test question, which is, was it a success? Let's just have a look at the way in which the projects were evaluated. We have various evaluations, including interviews, the questionnaires. We have the review of the websites that are produced by each one of these projects, and they're available online, so you can dig into more detail about how they worked and what they implemented. We have the observations of the exemplars during their program of work, because everything was held remotely via Zoom or team meetings. And we had one-to-one meetings with the exemplars concerned, so we could see the documentation that they prepared and all of their feelings during the course of this very short duration set of interventions. And here's the answer. 47% strongly agreed that their project had delivered a significant success. And a further 37% in this short time period agreed to a somewhat degree that they had actually made a successful intervention. This is remarkable achievement given the conditions that these teams were operating in. We can see on the bottom left that meeting of the objectives does explain why some people believe they had a somewhat success. So very strong result here as well, that 42% had actually achieved all their goals despite their ambitious nature. And this 53% was still in the process of working through their project, embedding it with all members of staff. Please remember, at this time in history, some staff members may well have been redeployed to other parts of the National Health Service. Not just that, though, we looked at whether the projects themselves would be important to developing better professional practice. And as you can see, 29% strongly agreed, with a further 41%, so 70% overall, believed that these are great additions, if written up, to professional practice development. But not just that, there's even better news. 84% strongly agreed that their project does actually totally reinforce government policy, with a further 11% taking it up to 95% of the projects stating that their project was important at the national government level. Furthermore, we have 29% of our exemplars that strongly agree that their project should be taught at universities, with a further 41% saying that there is something in their project, most of their project, that can be transferred into a teaching environment. That's a 70% impact rate. And better still, we can see here that the investments made by the government and made by the health boards in innovation leads and transformation leads and quality improvement leads means that the exemplars see there's a route to scale up their project to an all Wales basis and to share as a nation these innovations in improvement. So 32% strongly agreed, with a further 37 saying that they somewhat agreed and could see benefits in parts or most of their projects turned into a national programme. These are quite significant results, and they shouldn't and mustn't be understated. Another somewhat unusual finding was the fact that this cohort was actually formally taught business case development for one of the few cohorts that have actually gone through this process of developing business cases. And as you can see, a third of the exemplars strongly agree that they will and write business cases in the future, and they feel confident in doing so. So this again connects the exemplar innovation to the executive level of the health boards and the employers. In total, 69% said that they would be pretty good at developing a business case for their employer organization to take their projects to this next step. So that's a good and heartening result too. So let's move into the benefits. In terms of the projects here, concentrate on those blue segments of these pie charts, please. They're the strongly agrees. And you can see there's quite significant movements in patient satisfaction, in multiple stakeholder benefits, in improved service delivery, and improved staff morale. When you add in the orange segments, you can see how the pie charts are substantially dominated by the orange and blue, and that's the somewhat strongly sections here. So you can see that most of the key indicators, in fact all of the key indicators, have moved in the right direction. The bottom left shows patient safety, and it's very interesting to see that there was less strong advances in patient safety, which suggests that the processes that had bidded for Bevan Exemplar status were already in control. So they weren't going to make massive, substantial strides in clinical levels of safety because they were already under control and they were heading towards improvement and innovation. So I think that explains that part of the fact there's a less blue on that pie chart, but it shouldn't be alarming to anybody. It's actually a good sign. Some of the projects involve partnerships with third-party organizations, commercial businesses that were subject to furloughing. So when we assess the benefits from a technology partner point of view, there was a lot of investment by the technology partners in helping Welsh NHS professionals. So this is very encouraging, and it's very interesting to see that um, the spread of the innovation from one organisation that's piloted it under the Exemplar program to others is around about 50%. There's a belief that this technology will spread. It's been a valuable addition to the Exemplar program, and in actual fact, it would appear that the industrial partners have given an awful lot more and asked for an awful lot less in return for their investment in time. And when you consider these companies were largely furloughed, this is a very, very, very positive reflection on them and their uh, beliefs as well as their motives to support the Welsh NHS. So congratulations goes to the technology partners for their perseverance and their dedication to this program. Let's now switch our attention to the capability development in Wales. This is investment in the exemplars and their teams. And you can see here that most show that they've learned more about their process that they operate. So they're better informed in terms of making future improvement decisions. The exemplars also show massive improvements in their skills base and methods that they will use in the future, as well as parallel improvements in their confidence, their comfort with speaking to executive level people about their projects and delivering their projects to their peer groups, both within employer organizations and beyond. And once again, we find again the Bevan program rated as one of the best personal development programs that these exemplars and their teams have undertaken, which is quite a heartwarming result too. So do the exemplars feel part of the Bevan community, the alumni that is now 6 years old? Yes, they do. Do they feel they're part of the Bevan Commission? Yes, they do. Can they contribute to future agendas for improvement in Wales? Then again, yes, they do. So phenomenal results in this very sort of summarized approach to the report. The report will be out later, which details a lot more of the key indicators of the program evaluation. It would be remiss of me to stop without having a look at the pandemic, so let's have a quick look at the views of our exemplars during this time period. These are truly fascinating results. So the pandemic reduced resistance to change. It was an opportunity to transform and not just improve a little, but transform a service, and that you could introduce changes that previously would take years in a matter of weeks. And not just that, that the accelerated improvement would actually result in an acceptance of the new change and increase to some degree, or strongly agree, the team spirit during the pandemic. So the pandemic, horrid as it is and horrid as it was was a catalyst, and it provoked a very strong reaction from colleagues in the NHS. And this reaction is one that can only be applauded. So in the face of adversity, in the face of all of the hardships and the probability that their projects would not succeed, this is a tremendous result. And to harness a bad thing and turn it into a good thing that can drive change through is very, very applaudable. So in conclusion, you can see that this cohort has contributed a lot of good learning to our knowledge of how to improve and transform and innovate processes in Wales. At the outset, it should have failed. There's nothing there that would have indicated that any of these projects would bring success. But the adversity of a pandemic, of role changes, of going online, of patients and service users with concerns and needs that still need to be met during a pandemic seem to provoke a reaction that is quite outstanding, a significant spirit and a significant level of achievement from all of the projects that were endorsed by the Bevan Commission. So there's a great legacy. There's a great legacy that this cohort brings to the previous 5 cohorts. And they've done these achievements in such a shorter amount of time. So again, we see continued importance of the Bevan prudent principles. We see a cohort that has enjoyed their experience. We've seen new additions this time in terms of business case planning and feeling more comfortable with developing a commercial justification for transformational improvement in the future. So in overall terms, if you look at the individual exemplar, their team, the patients and service users, the employer organisations, the industry partners, the cohort themselves, I can only commend it as another great success in quite a glittering legacy of cohorts over the years. So I've occupied enough of your time now. I'd just like to say a very, very big thank you to the exemplars and their teams, to their employer organisations, the partners that have provided support to our exemplars, the Bevan Commission themselves for having the foresight to deliver a programme in such conditions and in such a short time period, as well as the Welsh National Health Service in more broad terms, and the Welsh Government for supporting this programme. I fully commend it, and I think it's been a brilliant addition to the alumni of the Bevan Exemplar programme. Diawn and Ben Degenig, thank you very much for listening.